this is the week of bill introductions. So bills will all be put in place in the Senate by this Friday, but we wanted to take an opportunity to put out a bill which I think probably has the most monumental impact, not just on an epidemic in California, which is our children and obesity, but on our state budget. You should know that we are not only trying to solve a childhood obesity epidemic in California, but I think it's important to note that $41 billion of lost productivity and also healthcare costs are because of what I would say these sweetened beverages that are proliferating more so every single year here in California. And if you think about it, it's about half our state budget is impacted in many ways. So the goal is also to, in essence, find out very good ways to get our kids the kinds of things that they need, which are drinks that don't, in essence, add to type 2 diabetes, but also to provide some funding, necessary funding for PE programs in our schools to make sure that we have the types of activities that kids need in terms of more parks. I mean, this particular proposal is not a solve-all to the issue of obesity, but it is a very large part of moving the ball forward here in the state of California in terms of making sure that we have a holistic approach to exercise and calorie intake. And I want to make sure that's put within context. I stand very, very proud to sponsor a bill offered by folks who have been talking about this issue in the state legislature and been working diligently. Whether it's been through making sure people understand calories and making sure menus are printed with those, or making sure we pulled these drinks out of our schools. Senator Padilla, Senator Scutia have moved the dialogue in the legislature to a point that I'm very proud to introduce legislation today, Senate Bill 1210, that will, in essence, provide a revenue stream and, more importantly, fund obesity prevention programs in the state of California. The goal of this measure, obviously, is to provide, if you will, a 1 cent per teaspoon surcharge on every sweetened beverage that is in our markets and that is being sold in California. And the goal of that is to, in essence, as I've mentioned, recognize that the more sugar that's added to the drink, the more we're asking folks to participate in helping with our obesity problem in California. You should know that the things that are in front of you will be mentioned by Harold and a few others, but let me just put it in perspective, at least coming from one of the areas that has the highest consumption of drinks, these sweetened drinks in California, the Central Valley, where 19 people a week die due to diabetic types of illnesses. And that's well beyond an epidemic. That's a crisis. And I would say that I'm very proud to put this particular bill forward. Obviously, making sure that we have, if you will, this particular surcharge will not only raise revenue, but we believe will change consumption patterns in the state of California. We also hope that the manufacturers, who we know will fight this tooth and nail, will start to have a dialogue about reformulating their products to looking at healthier alternatives. They are beginning that process with water and a few other things, and I think that's something they should be looking at because California obviously is a big consumer of their products. And I also want to make sure everyone understands that government should be concerned with this issue. We absolutely should be concerned with the nutrition aspects of what our children are drinking. We should be concerned from a public health perspective, and we should be involved in the debate. Clearly, California is not the first state to do this. There are other states who have moved in this direction. There are a few states with pending legislation in this direction, and for California to be out of the loop completely when we have such a large state and we have such a huge impact on our public health system would be unconscionable. It is clear that we should now enter this debate in this legislature, that we should let people know that when they were picking up, in many cases, a 20-ounce can of a sweetened beverage, that they're picking up 17 teaspoons of sugar, and they are consuming that, and that is 3 times more than what any healthy American should be having. And I also want to applaud the efforts at the federal level. Just last week, Michelle Obama made a wonderful statement about how we need to now focus on a national level on these types of drinks. And she made it very clear that we didn't, in essence, our children didn't create this obesity problem for themselves. We as parents, the manufacturers and others who continue to target kids put these things in front of kids in the easiest way, marketed to them in the strongest way, and in many cases don't give our kids a running shot at living a life that is in many ways very healthy. And I think many studies have told us this. The most startling statistic to me is that in the year 2000, over 1/2 of kids born in the year 2000, that's my daughter, she was born in the year 2000, kids in that age realm, half of them, if you're Latino, have a chance of type 2 diabetes. 1/3 of African Americans have a chance of diabetes, all born in the year 2000. That means almost 1/3 of kids not giving them the running shot that they need for a healthy lifestyle due to these particular sweetened beverages. So if we can do anything to change consumption patterns, do anything to raise the money necessary to get them out for their 60 minutes of exercise, do anything to train parents that kids ages 2 to 10 should not be consuming a can of Coke, should not be consuming a can of Pepsi, should not be consuming sweetened drinks like Tropicana. These are the messages that we need to fund so that we can start to bring this epidemic down to a proportion that we can actually deal with. And so with that, I would like to have Harold come up and give us the entire, please take your time, story of this. I'm very thankful. We are the sponsors of this bill, and I'm very thankful Harold's been at the forefront of, as I mentioned, efforts with Senator Scutia, Senator Padilla, and we think this is the next step here in the state legislature, and we look forward to having this debate as we move forward in this particular session. So Harold. You're welcome.
Thank you, Senator, and thank you all for coming. As the Senator said, we are indeed in the midst of a $41 billion a year obesity epidemic. Those are costs in terms of healthcare costs and lost economic productivity. And as he said, as a direct result of this epidemic, 1/3 of children born in the year 2000 are expected to have diabetes, 1/2 of Latino and African American children. And as a direct result of this epidemic, this could be the first generation in modern history of kids to have a shorter life expectancy than their parents. So if we're serious about curbing the epidemic, we have to start with the biggest culprits. We have to start where the science takes us. And there is now absolutely overwhelming scientific evidence of the strong and direct link between consumption of sugar-sweetened beverages and obesity. A study that we released with UCLA last year showed that adults who drink a soda a day, are 27% more likely to be overweight or obese than adults who don't. And startlingly, that study showed that 41% of kids aged 2 through 11 and 62% of teens drink a soda or more a day. And as the Senator said, a 20-ounce soda has 17 teaspoons of sugar. Imagine eating 17 teaspoons of sugar. I'm on 5, 6. What you see here is how much sugar the average American consumes in sugar-sweetened beverages a year. 39 pounds of sugar a year. That's just about as much as my 6-year-old weighs. So when it comes to obesity, we can all agree that parents have the most important role to play. But it's also important to remember that parents have the biggest challenge. The beverage industry spends $500 million a year marketing their products directly to our kids, often underneath the protection of their parents. More money is spent marketing sweetened beverages to kids than any other food product. And now, just a dime on a can of soda could raise $1.5 billion a year, going right to schools, right to neighborhoods, right to parks, so that we can put a stop to childhood obesity and early onset diabetes once and for all, so that our kids can grow up living healthy and productive lives, so that anytime you walk into a school, we'll see kids eating healthy meals. When we walk into schools, we'll see kids participating in physical education that they enjoy. So that our cities have safe and attractive parks, we'll see kids playing in those parks. So that our neighborhoods will have, that what's most available in our neighborhoods and most affordable in our neighborhoods will be healthy foods rather than unhealthy ones. So there's often this question of why focus on sodas, and I'd like to answer that question even before you ask. Certainly, obesity has a lot of contributing factors. that, as I said, if we're serious about tackling the obesity epidemic, we have to pay attention to the biggest culprits. There is now absolutely overwhelming scientific evidence of the link between soda consumption and obesity. There are cross-sectional studies, longitudinal studies, intervention trials, national intake studies, studies examining the response to consuming liquid calories. Sugar-sweetened beverages are the only product that has that breadth of research showing its link to obesity. If you look at the number of calories that the average American consumes every day, on average, we're consuming just about 300 more calories per day. Of those new calories, almost half of them are new soda calories. And all the more important, the human body doesn't recognize calories. The human body doesn't recognize the calories that we consume from beverages in the same way that we recognize calories from solid foods. If you think about it, you have a meal, you drink a diet soda or a regular soda, it doesn't change what you consume for the rest of the day. So lots of reasons to focus on sugar-sweetened beverages. As the Senator talked about with what the First Lady described, our kids didn't create this problem. We did, and it's up to us to fix this problem. Thank you.
Thank you. Good afternoon. I'm Teresa Stark. I'm with the California Medical Association. We represent about 35,000 physicians around the state. We'd like to thank Senator Florez and the Center for Public Health Advocacy for bringing this important issue to the legislature. The physicians of the California Medical Association have been concerned for years about the increased consumption of soda and other sweetened beverages and their link with obesity. Doctors are particularly worried about the health risks that these beverages pose for children and teenagers. The negative health effects, as you've heard, of consuming these sugar-laden beverages are well documented in the literature. There is a clear and startling link that shows consuming these beverages directly contributes to obesity because of the way our bodies process, or rather cannot process, sugar in liquid form. So the science is there, and now we need to do something about it. One of the most effective public health initiatives that we have undertaken in California is the tobacco tax, and how increasing taxes on tobacco products has dramatically reduced consumption, especially among young people. This legislation that we are talking about today is based on that same public health model. Price the unhealthy product in a way that puts it out of reach and discourages consumption among the most vulnerable in our population, and then dedicate the increased revenues for those who choose to continue to consume it to programs that will help prevent the serious health consequences that result from consuming that product. So it's a formula that we know already works. And the consumption of these sugary beverages is startling, especially among kids. 40% of small children under the age of 11 consume at least one of these beverages a day. For teenagers, 62% of teenagers consume at least one of these per day. Doctors are very concerned about the fact that kids, particularly adolescents, are getting many of their daily calories from these products. They are basically on liquid diets that are providing no nutritional value whatsoever. These products are replacing healthy foods in the diet of young people, and as you've heard, adding hundreds of calories to the diet that they don't need and does them no good. They choose these beverages instead of milk or water or natural juice, and oftentimes they make up an entire meal. Furthermore, what's I think an important point, especially for kids, is many of these sweetened beverages also come with caffeine and other types of energy boosting chemicals. So these kids can quickly become addicted to these beverages. These products are habit forming, and it's a habit that will cause serious health implications for these kids later in life. And the revenue from this tax is also critical to try to counteract what you've already heard, the hundreds of millions of dollars spent by this industry to get kids hooked early. Big Soda is going after our kids just like Big Tobacco did, relentlessly marketing this product to them so they'll get addicted early and develop this habit and keep it throughout their lives. They portray these drinks as cool and hip, Monster and Snapple and Gatorade and vitamin water. These are the cool beverages to drink these days. Vitamin water and Gatorade are portrayed as healthy beverages, part of a a fit and healthy and active lifestyle. People don't know the amount of sugar that they're consuming when they drink these products. So it's time to put our kids first and arrest this very unhealthy trend so that our kids can have a healthy lifestyle and a great quality of life down the road. It's our responsibility to do something about this. The physicians of CMA thank the Senator and the Center for Public Health Advocacy for their leadership on this issue, and we look forward to working on the issue. Thank you.
Hi, I'm Joel Cohen. I'm with the Dental Health Foundation, and many of the points I was going to make are actually similar to those that have been made. And so the oral health community really would like to thank Senator Florez and the California Center for Public Health Advocacy for bringing in the oral health community in a fight that will make our kids healthier. A major concern that the oral health community has is that while we know that tooth decay in the state is dropping, we also know that it's going up in the low-income communities. And as was mentioned earlier, we also know that the soda industry is furiously fighting with major marketing tools to encourage people to drink these unhealthy foods and snacks and sodas. And we really need to counteract that in some way. In addition, we need to come up with some preventive tools so that when kids are drinking this, that they understand the importance of keeping their teeth clean and healthy. And once again, while many of the points that I was going to make have been made by my colleagues, I just think it's important to understand that there's a major thrust amongst kids right now to eat and drink unhealthy things, and that if kids do not have healthy teeth, it affects the way they live, the way they learn, and the way that they will actually have jobs later on. Thank you.
Okay. We will take any questions, but I do want to end by simply saying that I think the overall theme of this legislation for this particular session is the health of our kids and making sure that we can end what seems to be, particularly if you look at the kids born in 2000, an epidemic that is about to hit California in a way that we aren't even prepared for. We have got to switch the debate from the dialogue of a Pepsi generation to a healthy generation. And I think the goal of this is to make sure that we begin that process in the legislature this session. And so we look forward to a vigorous debate with many of the beverage industry folks who will come to the legislature. I will only tell them that be prepared for a fight, because clearly California is going to want to save $41 billion in our healthcare system. We're clearly going to want to help the many children who out there who, no fault of their own and being targeted in many ways, that want a running chance at a healthy lifestyle. And I think that really this is what this debate will be about in the state legislature. Any questions?
Yeah, so I want to understand, we've got a $20 billion budget deficit, record high unemployment, and there's nothing more important to work on right now than a new sin tax for soft drinks?
Yeah, well, I would say that it should be nice to find the $20 billion in this state budget, with about half of the money coming from these types of programs. The additional money that would be created through this particular issue, I think, would save us a lot of money in the current budget system. What Californians really want at this point in time is not the old paradigm of creating new dollars or cutting new dollars. They want to actually see us stretch dollars. So if we're able to stretch dollars in our current programs, we're paying our healthcare system, as you probably know, causes a whole host of budgetary problems. But if we're able to take that, fix it, with proactive measures like this, I think ultimately we're not going to have the $20 billion deficits that we see. So I think this is very timely, and I think it's very much part and should be part of the discussion of how to save dollars with the current dollars we're getting. And if we're raising dollars, trying to make sure that the programs we currently have are being offloaded in a way that actually is going to save us money in the long run.
Well, Senator, with all due respect, 14% approval rating, you guys can't manage the state legislature.
Right.
How are you going to manage people's lives?
Well, I don't think it's really about making sure that people know that they have some choices. Just as we in the legislature deal with gas taxes or tobacco taxes, the overall issue here is to try to discourage, if you will, the types of things that are costing all of us as taxpayers money. I don't think there's anyone out there that wants to continue to go to an emergency room that's full due to the fact that people are in there because they haven't, in many cases, taken care of themselves through these very, very bad drinks. And quite frankly, I think people want to make sure if you're going to, in essence, make yourself sick with these drinks, you ought to be the one to pay for them, not everyone else. And I think the goal of this legislation is to make sure that we do that. Yeah.
Addressing health concerns, the first indicator that made the public aware of the danger of smoking was when the Surgeon General stamp had to be put onto cigarettes. Is there any talk or discussion or thought about doing that sort of thing to these drinks so that people are more aware of them?
Well, I will tell you that, and I'm going to Harold answer a portion of this, but the goal of this legislation also is to have some very vigorous hearings starting in the Food and Agriculture Committee, which I chair. We have to have and bring in the industry and ask them some very, very tough questions about where they're going with all of this marketing and where they see what their role is in trying to create healthy California kids. And I think what we'll find in that debate are a whole host of other issues that we ought to be taking up. Labeling is one of those issues in terms of sugar content. I think, as Teresa said, I don't think people are aware when they're picking up a Pepsi or a Coke that they're having 17 teaspoons of sugar poured down their throat and ultimately paying a price for that. People ought to be aware of those. The way we do that, we believe, is to fund programs that make people highly aware of these types of things. It's worked in many other cases. And I think all of those issues need to be brought out, but as you guys know, that we don't really have those debates unless we have a bill, we have a proposal, we have something on the table, we have something for the industry to come and talk to us about in a very serious way, because clearly they haven't talked to Californians yet. The only way that they're talking to Californians are through commercials, whether it's Dr. Dre talking to teenagers about how cool it is to drink Dr. Pepper, whether it's Christina Aguilera talking in Spanish to those and saying, if you drink a Coke, you'll be just like me, or whether it's all the marketing that we've seen throughout that ultimately targets our children in very unfair ways. Those debates and discussions need to occur as much as and a part of this proposal as we go forward. I look forward to that very vigorous debate. We think about 3 or 4 hearings will probably be take place on this proposal before it actually gets to the governor. And Harold, do you want to answer some of that?
Sure. Packaged food labeling is the jurisdiction of the federal government, and so we would call on the federal government to change the packaged food labeling law so that the number of teaspoons is in bold print on the front of every sugar-sweetened beverage, so that all Americans will know that there's 17 teaspoons of sugar in that beverage they're about to pour down their mouth.
Dean?
Yes.
Knowing how tax averse or fee averse that some members of the legislature are, how do you expect to get this through?
Well, I think we're going to first of all recognize that I think as a Democratic caucus, this is something that we would embrace because, quite frankly, we're trying to solve as much as our budget problem as possible, and we need to make sure that we take some money out of the system and healthcare costs. So I don't think there's anyone out there who doesn't think that we need to bring the cost of our healthcare system down. And I think we're going to appeal to many of our Republican colleagues and make them understand that the way you save money is you put in prevention programs that ultimately save us the types of money going out the door in the long run. And I'm very, very confident that they're going to look, my colleagues are going to look at what Arkansas has done, or Tennessee, or Virginia, or West Virginia, and the other states. All of these states have moved in this direction. We have 4 other states pending: Colorado, New Mexico, New York. The entire state governments are having this debate, and I think Michelle Obama weighed into this even last week, saying this is something that we should really look at a federal level. So I think the timing is good for California to have this particular debate. And clearly we've moved in a direction, the governor's moved in a direction of making sure that calories are posted and known, making sure that these soft drinks are out of our schools. And we have a governor we believe is going to be very favorable to this type of legislation because he's always moved in a direction to make sure kids were healthy, make sure kids were active, and he's always pushed for more funding for the types of programs that we're going to be pushing for. So we think this is one of those bipartisan types of pieces of legislation that ultimately will get to the governor, hopefully signed by him.
How is the tax on soda specifically going to make kids skinnier?
Well, I think the issue is how do we control, in many cases, consumption, and how do we discourage bad consumption? And I think as Teresa said earlier, if you look at tobacco, for example, for every 10% increase in tobacco, we saw a 5% reduction in consumption. No different for these particular drinks as well. We see that model working here. And I think it's important because Californians, I think, are really tired of paying for everybody else's unhealthy habits. It's time that the people with the unhealthy habits pay for their own unhealthy habits. And actually start to pay more for what they're drinking, because everyone else is tired of that. And it's costing our system a lot of money. It's putting our budget in red ink, and it's time that everybody take individual responsibility. This particular bill does that. It says if you're going to pick up 17 teaspoons of sugar, that you're going to pay more for that, because the rest of us who are drinking water, who are trying to live a healthier lifestyle, are really tired of paying for a system that rewards or doesn't reward folks who are making bad choices. That's really what I think this is going to be about. Yeah?
Isn't part of the problem just that, having all these pop machines at schools? Is anything being able to address that situation?
Well, Harold, do you want to talk about that? I think that's...
Sure. So Governor Schwarzenegger in 2005 signed legislation, SB 965, to get one set of sugar-sweetened beverages out. The regular soda pop is now out of California schools K through 12. The beverage that's left, unfortunately, are sports drinks. And so all over California, in junior highs and high school, the beverages that a lot of kids are popping all day long are those sports drinks. And we're hoping to do something about that this year as well.
Can you tell us more about how this money would be used when you say programs to reduce obesity, or specifically what does that mean?
Sure. I mean, I think one of the important parts of this tax is it has really a threefold win. $1.5 billion as a result of Prop 98. 40% of that money will go straight to our public schools. So here's a way, having no general fund impact, 40% of that money goes straight to our local schools. The rest of that money would be used specifically for obesity prevention programs. This would be money going to our cities, to our schools, specifically to make sure that kids in our schools have healthy food to eat, that kids have, that we go into our schools, what we'll see is kids playing and having a form of physical education that they enjoy, so that we'll have parks, that all our cities will have parks and playgrounds where kids can play and enjoy themselves, so that our cities will have bike paths and walking trails. Again, all of this money, a way of solving this problem, as the senator so eloquently said, without any general fund impact. We're not talking about taking money away from anything else. We're talking about putting a surcharge on beverages that are the single largest contributor to the obesity epidemic, and using that money directly to solve the problems that those products are causing.
Let me say one thing to that as well. And I want to go back to maybe the governor being so enamored with making sure that we are allowing our children to have a much healthier lifestyle. I have had a bill I've put in for many, many years to create one simple thing, and that is senior year in high school PE. When we ran into budget problems in the state of California, we got rid of PE in your senior year. So unlike the rest of folks that may have grown up in earlier generations, there's no exercise activity for many of our seniors unless it's an option that they now take. The cost of that senior year of activity in high schools is $310 million. I can tell you that if we're going to move money into our schools to allow for the exercise necessary so that they leave high school with a much healthier lifestyle, I think it was mentioned the adolescent rate of folks leaving our schools and drinking these beverages, 70% in one of my counties, Tulare County. They need a running shot at PE. They need to burn off some of those calories as well, but if they don't have the money to do that, because our general fund doesn't allow for that, and if we can actually try to supplant that, I think those are the kinds of activities everyone in California scratches their head and said, what happened to good old exercise and PE? Well, good old exercise and PE needs to be funded with programs like this, and that's why it makes a lot of sense on the back and the front end to make sure that they're not unhealthy in the back end and end up in our emergency rooms or end up with very, very serious types of problems, from heart problems to diabetes and type 2 diabetes. I mean, this is really costing our society a ton. But for a few pennies, I think this would actually save us a lot of money in the long run. Anyone else? Thank you for coming. We appreciate it.